Good morning and welcome to Reality RT, the show where we uncover the real trends and issues that recreation professionals are discovering today. I'm TR Chan and I'll be your host for the morning. Today we are joined virtually by a very special guest, health model Mallory. Mallory is here to tell us about a trending model of health that could seriously optimize the lives of our clients. Welcome to the show, Mallory.
Thanks, dear Tan. I'm so excited to be here. You're right. The illness prevention and health promotion model is both fascinating and groundbreaking in a way that will help our clients. I'm so excited to share it with you today.
That is great to hear. Why don't you start by telling us a little bit about this new model of health? What is health promotion and illness prevention?
Great question. According to my research, health promotion and illness prevention involves optimizing the health status of a client. Rather than waiting until a serious illness or injury is present, this model involves finding potential threats to a health status and promoting health. This way, the client can hopefully avoid illness or injury and live the happiest, healthiest life possible.
So, you're saying that this model involves early intervention, finding potential threats to a client's health status before they become debilitating issues, and forming our objectives based on optimizing health status rather than just treating issues once they arise?
That is exactly right, TRTN. This model is so much more about taking preventative steps to promote health in early stages of risk than previous models. Other models suggest health professionals would not intervene until risk was imminent or actually debilitating to the client.
That is fascinating. This seems like great news for all involved. The client is optimizing their health status and hopefully preventing illness or injury, and we as helping professions get to be a part of it. Speaking of helping professions, tell me about the role of therapeutic recreation in this model. Where do we fit into such a fascinating shift in the provision of healthcare?
Again, a great question, Tan. To answer this one, I am going to quote a great recreation researcher, Austin. In regards to this model, they said, quote, "The mission of this model is to use activity, recreation, and leisure to help people deal with barriers that serve as problems to health and assist them to grow toward their highest levels of health and wellness," close quote. What does all of this mean? Essentially, I believe Austin is saying that we as recreation professionals can use all of our skills to optimize people's health. We can make it our duty to use recreation and leisure to give people the healthiest lives possible and not just intervene when an illness or injury becomes debilitating.
That's great information, Mallory. It still leaves me wondering, how do we practically make this happen? Don't most people only come into our care when their health status becomes such that they are struggling to function without intervention? How do we intervene early? What does this look like for us?
To answer this question, I'd love to go through an example. Let's start with Mary Sue. Mary Sue is an 80-year-old woman living in an SL2 designated living facility. She was married for 54 years, but her husband passed away from a heart attack in 2017. It was after the heart attack that Mary Sue moved out of the home that her and her husband built. Mary has been diagnosed with hypertension and type 2 diabetes. Her family is noticing that Mary spends most of the day in her room and doesn't socialize much with the other residents in the facility. Our chart tells us that Mary has been interested in reading, bird watching, watching movies, and she used to downhill ski. She has 2 children, 4 grandchildren, and 1 great-grandchild on the way. Although there are no new issues, there has been a referral to recreation therapy to assess Mary for assessment and health promotion purposes. How could we as recreation therapists promote the health promotion and illness prevention model in our treatment modality?
I think this example provides lots of opportunity to promote this model. From what you have told us, it's about finding risks to health and trying to promote optimum health status. One thing we know about Mary Sue is that she is diabetic. Although the example doesn't list any emergent issues arising from her diabetes, it would be in the best interest of her health to eat a healthy, low-sugar diet. What if we as recreation professionals got her involved in a healthy cooking group or class? Since she lives in an SL2 facility, we could find these resources in the facility or in the community that would offer these resources. This would optimize Mary's health status and reduce the risk of further damage from her illness.
What a great example, Tan. Now I'll take a turn incorporating the illness prevention and health promotion model into Mary Sue's treatment. I noticed in the example that Mary Sue was starting to isolate. Knowing this model, I would immediately see a risk that could impact Mary's overall being. As therapeutic recreation professionals, we know the devastating impact of loneliness in our senior population. I know through this model that we don't have to wait for Mary to have an official mental health diagnosis for us to get involved. Sorry, one sec.
No problem. Wellness model, Mallory.
I know through this model that we don't have to wait for Mary to have an official mental health diagnosis for us to step in and take action. We can promote her health and reduce her risk by working to get her involved in social groups, either in or out of the facility. We could build on hobbies from her past or help her start a new hobby. The opportunities are endless, really.
Wow, I am loving the idea of this model. It seems like it could have a huge impact on our entire healthcare system, and specifically in our therapeutic recreation practice. So tell me, health model Mallory, where did this model come from? How long has it been around? Who came up with this great idea?
The idea of the health promotion model originally came from Nola J. Pender, a nursing theorist. The model first appeared in literature in 1982, but was specific to nursing practice. The focus was primarily on public health and promoting healthy lifestyles, rather than just treating illnesses as they came up.
Sounds like Nola Pender had a great idea. When did therapeutic recreation start to focus on this model?
Well, in 1996, Austin produced some literature that we talked about earlier. This was the first research that specifically referenced the health promotion model in therapeutic recreation practice. That being said, if we look at therapeutic recreation as a whole, health promotion has been at its roots from the beginning. In my opinion, we as therapeutic recreation professionals have been striving to reduce the impact of injuries and promotion overall. Oh my goodness, let me try that again. In my opinion, we as therapeutic recreation professionals have been striving to reduce the impact of injuries and promote overall health for about as long as the profession has been around. The popularization of this model, if anything, helped to validate that what therapeutic recreation professionals were already doing.
That is great news for recreation professionals everywhere. Would you say this model is starting to catch on? If it was first published in 1982, we've had nearly 40 years to work on health promotion as a modality of healthcare. What are the barriers stopping it from becoming popularized?
Well, there are three main categories when it comes to barriers preventing individuals from jumping on board with the health promotion and illness prevention model. Listen closely, as addressing these barriers could be the future of your therapeutic recreation practice.
All right, we're ready. What's the first barrier?
The first barrier to the health promotion and illness prevention model is internal barriers. This includes lack of motivation, lack of time, lack of knowledge regarding the health decision, and the difficulty of making a change.
That sounds like something we can address as recreation professionals for sure. Sounds to me like leisure education, letting people know that positive change will be worth it and helping them to make the time for it. Also letting them know that we can help them access the resources around them.
You're so right, Tan. This is how the health promotion model is shaping the future of our practice. It's all about education and application. To quote Kathy Irving, educate, educate, advocate, advocate, close quote. Let's move on to barrier number 2, interpersonal barriers. This comes down to the people our clients surround themselves with and how they impact their decisions.
Like peer pressure?
That is one example, but there are several ways that our interpersonal relationships can affect our motivation for change. Whether or not our family and friends want us to change is a huge one.
How can we influence this as recreation professionals?
I think the biggest thing we can do is find positive social circles for our clients. There are so many social activities and groups out there, and we can help those we are helping to find people that will support their decisions toward health promotion.
Sounds great to me. Now, what's the final barrier?
The final barrier we are going to address may be a little more tricky to assess as recreation professionals. This is environmental barriers to health promotion. Essentially, this barrier comes down to the resources available to our clients. This could mean financial resources, geographical resources, or transportation barriers. All of these could stop people from taking part in health promotion and may keep them away from the health model altogether until they really need it.
That's a really hard one. How can we encourage health promotion activities when people just don't have the resources to access them?
I think this is when innovation is needed most, a word that is shaping the future of our profession. We can use technology, for example, to access people in rural areas without transportation. This is something we are getting better and better at.
True. Another example could be addressing financial barriers. We could use leisure education to find a local community center that offers free health promoting activities across the domains of health. Whether it be a walking group, a cooking class, or a purely social activity, cost-effective leisure could be a huge part of health promotion.
That is so true. Great evidence for this model, Tiara Tan.
Thank you. Now, I know we have a lot of students viewing the show today. How does this affect them? How can they learn more about this model?
You students out there probably have heard of this model before and will continue to hear more about it throughout your education. As healthcare leans more toward the health promotion model, the best thing you can do is to keep researching. Never stop learning about the new trends in healthcare.
So you think this model is really taking off?
Absolutely. Let's look at mindfulness as an example of a trending health activity. If you think about it, it's all about health promotion and illness prevention. When someone is in the middle of a crisis, mindfulness may not be the most helpful tool. However, we teach it to promote overall promotion of well-being so that hopefully crises will happen less and less often. This is not only great for the general public, but it is a great financial decision for our healthcare system. The more we can promote people's health and well-being, the less we see people in the hospital and have to spend on expensive treatments. From therapeutic recreation to the finance department, health promotion and illness prevention is just an overall great idea.
That is great. Thank you so much, Mallory, for joining us at Reality RT, and we hope you have a great day full of productive and meaningful leisure.